Hey guys, I'm back with Patricia. In case if you didn't get to the first video, you've got to catch it. She is a wealth of knowledge, super mom. Thank you for all that you're doing for your son and for the community and just in general. Thank you.
Thank, thank you, Kelly. Thank you for having us. I did want to add, we would not be where we're at if it wasn't for my very supportive husband, who's been there with me every step of the way.
I love it. I love it. You know, at one time, the statistics were 80% of individuals with a child with special needs, especially in the autism spectrum, were divorced. So yeah, it does take a strong unit to ensure the best for our special
You
kids.
you just reminded me on our first appointment, October 2018, with this functional medicine doctor. She went over the risk of divorce for parents with kids with PANDAS,
Uh-huh.
and just to let me and my husband know that that's a risk. So thank you for pointing that out.
Wait, what was the date?
It was in October of 2018 that we met
Oh,
with
okay. I thought you said October
doctor.
20th because that's my birthday. I was like, wait a minute. So, but
And I was a bit annoyed at the time because I'm like, why is she talking about divorce, you know? But I have appreciation that she gave us that information right off the top. She
it
said,
takes
keep an eye on your marriage. It's going to be tough on the marriage.
It takes a true commitment from
Hmm.
all
Hmm.
parties. So I wanted to just really quickly go back into what we were talking about is PANDAS. PANDAS is a diagnosis that where there are certain social behaviors that can be confused with autism, ADHD, OCD. It can be confused with a lot of different things. It's often misdiagnosed before it is properly diagnosed. So therefore, it can delay treatment for kids, delay, you know, or increase anxiety and all the other kind of symptoms that come along. Keeping in mind, the earlier PANDAS is detected, the earlier the PANDAS is serviced, the more likelihood that the treatment can be a more modified treatment. So there are different levels of treatment. There's mild cases where you can use antibiotics, you can use sulfur, you can use a lot of the homeopathic methods, allergy shots, etc. When the situation progresses to a higher level or a greater level of infection, infection and virus, then basically, or crossing of the blood-brain barrier, where the antibodies are now in other areas of the brain. And let me just backtrack really quickly. So just think of this: when a child has an infection, right? When a child has an infection, there's something called the microglia. It's called microglia activation. It's the immune system that protects the central nervous system, the brain and the spine. So when an infection occurs, the microglia extends out and tries to protect that particular area that has been injured, be it trauma, infection, whatever. What happens is when we're talking about PANDAS, that microglia goes into hyperactive mode. So whereas, maybe you needed like a little bit of microglia or a little bit of protection, just a concentrated method, or measurement, so you only need a little bit, but instead you go full force, or instead of putting a spoon of salt on something, you put a cup of salt on something. So it's that cup of salt that now goes out from the microglia, and what it does is it attacks the healthy brain cells. So now what happens is individuals with PANDAS, they're no longer thinking and processing the way that you or I may do when a complex situation comes around. So when that happens and kids have adverse or different social behaviors, it can be a challenge for parents. It can be a challenge for caregivers to explain to the community at large what's going on. And Patricia has something that she has used to help others understand. And there's also a sensitivity measure with individuals who have PANDAS. So please
So
share.
I think so whenever we had to go to any provider, a regular doctor, any eye checkup, going to see anybody, and my son was there, I would put in a message on my note. I don't have it in this phone, but in my other phone I had, my son has brain inflammation. I would just subtly show it to them and explain. I wouldn't even use the word PANDAS or PANS, Kelly, because some people have it's like a negative connotation.
Right.
with
Well, just some
medical
people don't
people.
understand it. And
So I always use just brain inflammation. And I would say my son has autoimmune encephalitis, brain inflammation. He has certain symptoms. Please be mindful as you interact. And the reason I did that is because just talking to somebody about him could trigger him into an aggression, a raging that would attack me physically.
because
And so that's kind of how we handle it.
he still understands and he still hears everything that's being said about him, to him, etc. So if you're saying something that is not complimentary towards him,
Yes.
he's hurt. I
Yes,
mean,
even though they can't, because his speech was regressed while he was sick, he couldn't connect thoughts and words and speak. He would react with aggression, with fight or flight. So what I want to say about that is when he was healing, when we had moments of, I would call David's coming to visit, because my son, his essence was back because he was stable. He would say to us, remember that time when you did that? That was really upsetting. And he wanted to make it known. Yes. And so the nice thing is his brain was able to process that upsetting event. That, to me, it was probably a traumatic event for him because it was so upsetting and threatening to him.
It was so upsetting that he responded physically. He couldn't respond verbally. So when he respond verbally, he did physically to let you know, hey, you know what? You're hurting me.
Yes, yes. So all this is still happening. This is why we need to treat our panda kids with dignity and treat them with respect, no matter what. And so that was my way to to advocate for him, to say, my son has brain inflammation. It may be difficult to get through this appointment. Please bear with us. And then, but did it so that he wouldn't hear it, but the person was still aware. And so, yeah, later on, as he got better, he would verbalize, I didn't like this, I didn't like that. And then he let it go. His brain was able to put it in the past and move forward. So that's what healing looks like for us.
Feel like, were you ever in a room with people where they were talking about him or going to talk about him? Did you ever feel like you had to let me tell you, stop, because what you're doing can cause more anger and aggression?
Yes.
Because he knows.
It is perfectly okay to take that person aside and away from your child, to explain what's going on and do it in private. That's exactly what we would do. Because
guess what? Just like you said, he told you, he doesn't forget. 3 months, 4 months down the road, he doesn't forget. That's that person who doesn't think highly of me. That's that person who doesn't, care about me, or that's that person who doesn't have high enough expectations of me to help me get to that place where I can visit or come back or be alive.
Yes. Yes.
What was the first thing you noticed when you started to see progress with David?
We've been through this journey since 2017, he got sick. 2018, we started treatment. And now it's 2013. So there's been different things with him, but it really, like, his beautiful essence coming back, like, he's so sweet. So that ragey person that would attack his dad and make him, like, really scratch him up and just go at it, that stopped happening, and we were able to reason with him. He can say, I don't like this, I do like this. His just essence of himself, the pet, like, he's a sweet, polite boy that liked animals. See him pet the dog, see him sweet talk the dog, see him sing to the dog was beautiful to see. That to me was like, there's my baby coming back.
There's hope.
Yes, I do believe that there is hope with this. I'm in that Yes,
There's
I've
so
seen
much
it.
you can do when there's hope. Do you know what I mean?
There is.
Parents sometimes just need to hear that there's hope. But guess who else needs to hear that there's hope?
So
Teachers.
Kelly, I wanna also chime in. Pans and pandas, right? So you did mention in the last video, yes, he had strep titer, so he had been afflicted with strep infection. We didn't even realize it. He had mycoplasma infection, so his came back positive, and then we had environmental exposure. So I live in a house in Northern Virginia that had a roof leak and also had leaking coming in from the basement. So I actually had moldy house. So we addressed the mold, we addressed everything. We tore up the house and rebuilt almost. And also in the last year, he was also diagnosed with Bartonella. And treatment of Bartonella has been really great. So it's been different layers of healing. And so we have to be patient and peel back little by little to see what we're still dealing with. Because remember, these kids' immune system is vulnerable, it's overwhelmed. And so we don't really know when he got the Bartonella, right? And so they're like they absorb and attract infections while they're vulnerable. And so that you have to be patient, you have to figure out, work with someone that is out there who's is curious as to what's going on and stick with it.
Right. And think out of the box. I
Mhm.
always say, sometimes, this is one of my sayings. Sometimes I say, you know what? We try to put band-aids on things that need stitches, right?
Yes.
So, and with the stitches, remember, if somebody has a stitch, you got to go in, you got to clean out the wound and all that other kind of stuff. So sometimes we don't take that time out. It's because we're doing everything's microwave. Got to get this done. Got to get this done. Oh yeah, check in the box. We're done. Whereas in reality, instead of just putting a band-aid on stuff and
Yes.
overgeneralizing, misdiagnosing, MISSED diagnosing, sometimes we have to take that deep dive to really and truly understand what's at the core, clean it out,
Yes.
and then sew it up, so that we don't go back down that road again. And that takes time. I mean, some surgeries and stitches and stuff take, hours, like, 5-10 hours, and some take, maybe 20-30 minutes. I don't know. But the bottom line is we have to do the deep dive to realize how long the surgery or the recovery or the treatment or the healing will take.
Yes, exactly. Well said.
Thank you. Thank you. I like to take things and just kind of like break them down so that,
Yes.
understand them. Um, Patricia, your insight has been phenomenal. Let me ask you this. Is there anything else that you would like to tell parents that they can do to help their child during the process? And what I was going to say is, we're talking about parents, but we can't forget that teachers need to know, you know, physicians in general need to know, because there's some physicians that have been in there since, Noah built the ark. So they may not be abreast of some of the stuff that's going on with PANDAS, but teachers need to know, physicians need to know, law enforcement needs to know, please forgive me, community, religious leaders need to know, even the convenience store. Imagine going into a convenience store with a person who has no idea what's going on with PANDAS and your son having an episode. What's he going to think? They got that little button underneath, they got guns and all this other kind of stuff, because what they're thinking is, oh my God, somebody's coming in to rob us or something like that. So what can you suggest for people as far as, once again, spreading the word? How can we spread the word? How can we help you?
So in the world of mental health, there are some symptoms that present as eloping, running away, fighting, aggression. I want people to know that those people are not trying to have a behavioral problem, that they cannot control themselves, and that there are underlying medical conditions that can cause these neuropsychiatric symptoms that range from anxiety to OCD to depression, but also aggression and eloping. And so these people also need to be looked at and have medical causes ruled out just as much as somebody that is having psychiatric symptoms but is not aggressive. I feel like when somebody presents with aggression, they are treated in a different way altogether. And yet they need the same medical review and treatment to help them remove these symptoms.
So more diagnostic measures, more screening measures, a more comprehensive approach. Yeah, I don't know. Are you familiar with value-based healthcare versus fee-based healthcare? So value-based healthcare means that I'm going to look at your historical data. I want to know what happened with your parents. I want to know what's going on in your environment. I want a whole comprehensive picture to understand what is needed to treat you to prevent, to circumvent, or disrupt a chronic health condition. So I'm doing this proactively, right?
Yes.
And informed, very well informed, comprehensively informed. But fee-based means it's the Band-Aid. So you come in, you're sick, okay, I'm gonna give you a pill, you gotta go. You know, I got 500 patients to see today. I'm exaggerating, but I got, what does the average doctor see? What, 20 patients a day, I think it is? I think they see like 20, okay. So I got, you're number 4, I got 16 more to go. So Band-Aid, you're good, let's go. So when we start to look at more of a functional or I'm sorry, value-based care, then we start to once again look through the process of what are the things that are at the core instead of just putting a Band-Aid on it and saying.
Yes, Kelly, when I started this, I had no idea what the term functional medicine stood for. But as I read about it, it got me excited. I found a functional doctor and they are looking at root cause. Again, going back to root cause versus Band-Aids. Because you'll get all kinds of Band-Aids and they'll only work for some time. If Band-Aids work forever, I say do it, right? But most likely it's not going to work as long as you want it to. And then you're going to have to get back to the drawing board. And so, yes, that is exactly what makes me get up every morning, is that root cause. What is causing this? How do I help it? I wanted to say, I didn't finish it up, but my son from the last video, I told you he was vaccine injured. He was actually vaccine injured twice. The first provider, a neurologist, said, do not vaccinate your child ever again. He can't take vaccines. But with my functional doctor, another doctor, we got to the point last year, 2 years ago, when we started vaccinating him again. And no reaction, no injury. And this is what I mean. There is a way on the other side, because I've lived through it. Just because you've been vaccinated once doesn't mean that that's going to be forever. You know? And so we were able to get him the COVID vaccine. We got him meningitis vaccine because he was in a good place to handle that immune disruption.
Because you went to the core of the challenge, cleaned out the crud, and then after you cleaned out the crud, now you have readiness. You don't have readiness. You know, if you have this and you put something on top of this, because you don't have a solid foundation, it's going to fall through the cracks. So that's what this is about, is making sure that these kids have a solid foundation. Because one of the things that I think sometimes we miss is, guess what? 5, 7 years from now, these kids are going to be 10 years, are going to be parents. And so if we don't take care of the stuff now, what's going to happen with the next generation? If suicide is the number 2 cause of death for adolescents right now, and we know that suicidal ideations is a part of PANDAS, let's start getting to the core. Let's get to the core and make everybody's life happier.
Yes, that's right.
Patricia, you are beautiful. You are here. Again, I thank you so much for being transparent, because a lot of times, once again, parents don't disclose things. You know, they don't disclose things. They don't disclose everything. So therefore, doctors can't treat them fully because of the embarrassment. You know, my kid's not like everybody else's. I'm embarrassed. So I thank you for your willingness to be open and transparent, because also I've spoken to some parents of kids with PANDAS, and they're afraid to speak up because they don't want to embarrass their child and that kind of stuff. But if we don't start talking, we can't start educating, and we can't start healing, right? And everybody else will just be diagnosed as ADHD or autism. I'm just kidding. I'm just kidding.
That is the easy route, you know, that's the easy route until you're
Band-Aid,
stuck and there's no way out.
Band-Aid, Band-Aid.
Mhm.
So once again, Patricia, thank you so much for everything. You are an amazing blessing. Thank your husband for being the amazing supportive parent that he is. And thank your son for having those times of visit, those times of light, those times of inspiration for, guess what, the conversation that we're having today, and also the hope that more parents will have in the future. Thank you for everything.
Thank you. And thank you for doing this because I believe somebody's going to watch your videos and something's going to click and it may save a life. And I tell as many parents as I can about PANDAS because if it saves one kid, if it
Yes.
gets treatment early, it's all worth it, Kelly. It's
Yes.
all worth it.
And you're not just saving the kid, you're saving the kid, you're saving the parents, saving the community, saving it's a trickle effect by just helping one child, you know.
Yep.
And the more tangible examples we can have of success, the more people will believe it. Because you know, a lot of people are like from Missouri, the show me state. So show me that it works, and then I'll support. And so your testimony is showing people that it works. So again, thank you. My daughter's gonna kill me. She's on her way here. She wants to go shopping. So, but thank you for everything. You are absolutely beautiful. Bye-bye.
Thank you, Kelly. Take care.
Hold on.